Breathing apparatus (BA) is a device worn to provide breathable air in an atmosphere that is immediately dangerous to life or health. Sometimes it is known as SCBA, self-contained breathing apparatus, and sometimes referred as CABA, compressed air breathing apparatus. Today, we will learn about the different types of hazardous conditions and hazardous substances. What are the different forms and properties of hazardous materials in our workplaces? How to identify and how to protect from their harmful effects to ourselves and our fellow workers. Hello and welcome. You are on the platform of Safety First. I'm your host, Javed. If you are new on this channel, kindly subscribe Safety First and press the bell icon for all future notifications. And if you find the video informative, then like, comment, and share with your friends. Let us jump on the main topic. What are the different forms of hazardous substances? Dear friends and fellows, hazardous substances can be present in the air as particles, solid or liquid, vapor or gas. Under certain conditions, they can exist in more than one form at the same time. For example, during paint spraying, you need to identify the form of hazardous substances in the air to select the right respiratory protective equipment. Solid and liquid forms will be present as particles. Fine sprays and mists are made up of liquid particles as droplets. Fumes are very fine solid particles and not gas or vapor. Smoke, fume, and airborne liquids require respiratory protective equipment that is suitable for use against these particles. Let us discuss now the different forms of hazardous substances, their properties with examples. Hazardous substance might be in the form of solid particles, particles of solid material, including aerosols, dust, fibers, smokes, and fume. The examples of solid particles are asbestos dust, engine exhaust particles and fumes, lead dust and fume, stone dust, welding fume, wood dust, smoke, fungal spores and parasites, bacteria and viruses, and lastly, flow. These all are the examples of solid particles. Let us look now the properties of liquid particles and their respective examples. The properties of liquid particles are fine sprays, mists, and aerosols made up of small droplets of liquid. The examples of liquid particles are paints, pesticides, powder coating mix, liquid jetting in the shape of mist, chrome acid, cutting fluids, and oil mist. These all are the different examples of liquid particles. Those are hazardous to health, and these substances or materials are readily available and used in our workplaces. Hazardous substance might be in the shape of vapor. It is in gaseous forms of a solid or liquid. The examples of vapor are solvent vapor, mercury vapor. Hazardous substance might be in the shape of gas, gaseous forms of a solid or liquid. The examples of hazardous substances in the form of gas are carbon monoxide, engine exhaust gases, sewer gases, and chlorine. After discussing the properties and examples of hazardous substances, now let us discuss about filters, because filters are used in respiratory protective equipment. There are various types of respirators. and they all rely on filter material to remove the hazard. The filter material will be different depending on the hazardous substance and its form. There are two types of basic filters. Number one, particle filters, and number two, gas or vapor filters. Remember that airborne liquids in the form of fine sprays and mists and solid materials, including dust, fibers, smoke, and fumes, required a particle filter. As air is breathed in, it passes through the filter, removing the contaminants before they reach the lungs. The respirator can either be made of the filter material, have a filter fitted to it, or use a motor to pass air through the filter that may be separate from the facepiece. But remember, particle filters don't protect against gas or vapor. Gas or vapor filters don't protect against particles. Neither filter type can be used in oxygen deficient atmosphere. These 3 points have vital importance, and you have to keep in your mind all the time once you are going to use, purchase, select, or going to make maintenance for the respiratory protective equipment. Dear friends and fellows, in the selection of breathing apparatus or any form of or any type of respiratory protective equipment, protection factor matters. Let us understand what is the meaning of protection factor while selecting a respiratory protective equipment. You need to ensure that the respiratory protective equipment you select can protect the worker from the hazardous substance in the air around them. Your decision will depend on the amount in the air and its forms, particles or vapors. There are various types of respirators and breathing apparatus available. The protection they offer will be determined by a number of things, including the protection factor. The APF, assigned protection factor, is a number rating that indicates how much protection that respiratory protective equipment is capable to provide. For example, respiratory protective equipment or the breathing apparatus with an APF assigned protective factor of 10 will reduce the wearer's exposure by at least a factor of 10 if used properly. Or, to put it another way, the wearer will only breathe in 1/10 or less of the amount of substance present in the air. There are only a few number ratings used. So, assigned protective factors will be either 4, 10, 20, 40, 200 or 2000. When calculating the protection factor, always choose an APF above the calculated value. APF stands for assigned protection factor. When choosing a breathing apparatus with an assigned protection factor capable of providing the wearer with adequate protection, you have to check, does the SDS provide advice on the required assigned protection factor? SDS means safety data sheet. Is there advice on the required APF in cost essentials? Is there advice on the required assigned protection factor in cost essentials? Does the substance have a prescribed workplace exposure limit? If so, you need to make sure the wearer is protected to a level below the workplace exposure limit. In addition, for hazardous substances that are classed as carcinogens and mutagens, or are a potential cause of occupational asthma. Exposure needs to be reduced to as low as a level is reasonably practicable. It is also important to remember that work activities involving microorganisms may be high risk even with limited exposures. If there is more than one hazard present, you will need to find out the protection factor for each and choose respiratory protective equipment based on the highest protection factor required. If you are unable to take exposure measurements in your workplace, or if the substance doesn't have a workplace exposure limit, your respiratory protective equipment supplier may be able to advise you on the required assigned protection factor for your situation or for your workplace. Dear friends and fellows, you are watching Safety First, and today we are discussing about breathing apparatus, where it can be used, what types or forms of hazardous substances, what atmosphere or conditions can be considered as hazardous. Let us discuss now the suitability factors for a respiratory protective equipment. Dear friends and fellows, you have to make sure the respiratory protective equipment you use is adequate to control the hazards. You need to ensure it is suitable for the individual wearer, the task they are doing, and the environment in which they are working. Other common factors about the wearer you need to consider are: do they have facial hair or markings that could prevent a good seal between the wearer's face and the breathing apparatus? Do they have any pre-existing medical conditions? Do they wear spectacles or contact lenses? It is important to know that some pre-existing medical conditions, examples include breathing disorders such as asthma, skin allergies, or even heart problems, may restrict or prevent some workers wearing any respiratory protective equipment or certain types of respiratory protective equipment. You will need to ensure that workers are fit to wear the selected and required respiratory protective equipment. If unsure, the employer should arrange for appropriate medical assessment. It is mandatory. Dear friends and fellows, let us discuss now the suitability factors about the task. There are a number of factors you need to consider for the task, including work rate, wear time, vision requirements, other head-worn PPE, personal protective equipment can potentially interfere with respiratory protective equipment, preventing other components from working correctly. For example, eye protection, ear protection, and safety helmets. Where possible, choose equipment where the different forms of protection required are combined. For example, eye, face, head, and respiratory protection provided by a powered helmet respirator. You also need to consider the workplace environment, for example, temperature or humidity. You make an assessment for the right respiratory protective equipment. You make an assessment for the suitability of the task. Now, the most important factor, that is the use of respiratory protective equipment. Let us understand now how to carry out a fit test for respiratory protective equipment. Dear friends and fellows, if you are considering respiratory protective equipment or breathing apparatus with a tight fitting face piece, you should make sure that each wearer undergoes a fit test. Remember, People come in different shapes and sizes. So, facial differences will mean that one kind of respiratory protective equipment is unlikely to fit all. The differences are even more significant between men, women, and people of different ethnicity. If the respiratory protective equipment doesn't fit, it will not protect the wearer. Face piece fit testing is a method of checking that a tight fitting face piece matches the wearer's facial features and seals adequately to their face. It will also help to identify unsuitable face pieces that should not be used. Remember that tight fitting respiratory protective equipment will only provide effective protection if the wearer is clean shaven without beard. So they should also be clean shaven when fit tested. You should carry out a fit test as part of the initial selection of the respiratory protective equipment. If respiratory protective equipment is used frequently, it is good practice to ensure repeat fit testing is carried out on a regular basis. If the fit test report is not satisfactory, it is not conducted, there is no assurance that the wearer can protect himself from the hazardous substances. In this case, all the practice is useless. Your expenses on breathing apparatus or any shape of respiratory protective equipment is just a waste, no use. Here the question is when to carry out fit test. Fit test shall be carried out before wearing, and in a normal practice, the organization or the management should make a schedule for drills, for exercises. The nominated or assigned members of different emergency teams, they will wear, they will learn how to carry out fit test. Once there is an actual emergency, they can not only met with the emergency successfully, but they can also protect themselves and the other those are in need of help at that time. And that's all for today. Training session related to breathing apparatus, selection, fit test, types and forms of hazardous substances, types of filters is over now. If you have any question, please ask in the comment section. Thanks for watching, and don't forget to like, comment and share. Hope to see you soon with a new HSC tutorial. Till then, take care, good luck and Allah Hafiz.